Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to another episode of All Things Policy. My name is Arjun and I work as a research analyst at the Takshashila Institution. Today we have with us Priyal, who is also a research analyst at the Takshashila Institution, and we're going to talk about something related to long COVID. But before we get into the conversation, I'd just like to give a shout out to our academic courses. The Takshashila Institution, as you know, is a think tank and a school of public policy. We have education programs lasting 1 semester and 1 year, which are tailored specifically for people like you. They're all online and you can take them from anywhere. Admissions are now open for our 12-week graduate certificate program in public policy, defense and foreign affairs, and also technology and policy. Application deadline for the September 2022 cohort is 27th August. Please visit school.takshashila.org.in to find out more. Now that we have got past that, let's get into the conversation. Hi, Priyal. How are you doing? Nice to have you here.
Hi, Arjun. Thank you for having me. I'm doing good. How are you?
Yes. I mean, we're still working hybrid due to the pandemic, and that's what we're going to be talking about. I mean, it's been 2.5 years now since COVID-19 pandemic actually hit.
Right.
But there are still, new reports and new research coming out about the different aspects and the different symptoms and the long-lasting effects of COVID-19, right? So that's what we're here to talk about. So Priyal, just for our listeners, what exactly is long COVID? And just how do you differentiate between like the normal COVID-19 and the rest of the different multiple variants which are there?
Right. So, okay, to begin with, I think this entire topic that came up was just a random, this was something that I got to know about it was because Lancet had recently published a report. And that's what got my curiosity about what exactly long COVID was. And that this entire podcast, etc., is just based on like what I've read and what little bit I know about COVID because I'm not a medical professional, right? But to give our listeners like a short introduction or sort of a small definition of what long COVID is, it's basically, so Center for Disease Control, CDC, defines long COVID as when infected people experience long-term effects from their infection of COVID-19 virus. Now, we know COVID-19 virus that has like wreaked havoc in our lives since beginning of 2020, right? Or late 2019. And everything that, the hybrid setup, the mask and the social distancing, everything is because of it. And people who have suffered from COVID-19 have these symptoms, have this condition called as the long COVID, but it is frequently observed in people who have suffered from severe COVID-19 infection. Okay. But that doesn't mean that if you've had like mild symptoms, you're excused from it. There have also been certain reports that have said that people who have experienced mild symptoms may also suffer from long COVID. And but there has new evidence about this keeps coming up. There are certain studies that have been going on for a while now. And the evidence has suggested that non-vaccinated people could be more susceptible to long COVID compared to the vaccinated people. Now, typically what happens is, you have COVID-19 symptoms that last for at least 3 weeks or some minimum 2 to 3 weeks, right? And the symptoms of long COVID, on the other hand, they appear 4 weeks after the initial infection. Okay. And the problem with this is that there's no like one standard test to determine if you have long COVID or not, which has become very challenging for the healthcare providers, because if you have one test, you do that test and if you have like a long COVID, right? But here you can't determine it by one test itself.
Okay, that's kind of not surprising to hear because we kind of predicted that COVID-19 would have some kind of lasting effect on people, and this study just proves that whatever had been sent around 1.5 to 2 years back is kind of true. So, but again, just for understanding, right, what exactly is the symptoms of long COVID? So is it just similar to the symptoms of a normal COVID-19 infection?
Right.
Or is it just the fact that the same symptoms appear after a longer period of time? Or
Right.
are there, worsening conditions or
Uh,
something like that? And does it actually depend on the extent to which the person was first infected? Like you said that even the people who had got mild symptoms can experience long COVID itself.
right.
But like, so what? Like, if the person has just been asymptomatic when he was infected in the beginning, will long COVID symptoms maybe I don't know, like 5 weeks later show up, and how can we kind of get to know whether it is again the same thing?
Right. So actually, if so, let me go first at the symptoms. Okay. Now,
Mhm.
initially, first it was believed that the long COVID was actually characterized by symptoms like fatigue, muscle pain, joint pains, headaches, insomnia, breathing trouble, as well as like pounding heart, etc. Now, with more studies that came up and more people complaining about like what do you say, problems even after like they were recovered from COVID, CDC also added extra symptoms such as like that feeling of that pins and needles in your body, anxiety, depression, change in taste, change in smell over time. Women also complained about changes in menstrual cycle. And then there were further reporting of symptoms like dizziness, hallucinations, nausea, and pain in the testicles, etc. And a lot of these studies of long COVID have been done in adults, all right? And like I did not come across any studies done on asymptomatic COVID infected people. So I can't really say if if you were asymptomatic, will you suffer from long COVID in the long run? But what we've understood about long COVID is that it doesn't exactly distinguish between, a person who suffered from mild COVID to a person who suffered from like a really bad COVID. Adding on also another thing that I've also read was that if you have predisposed conditions like you have some issues in you beforehand, long COVID can make it worse. Like that those symptoms, those problems can sort of get worse if you're suffering from long COVID. So now, because of there are so many plethora of symptoms that you have right with long COVID right now, which is why it kind of makes it very difficult for healthcare providers to sort of identify the symptoms that are caused by long COVID. Which is why, like when I said that we cannot diagnose long COVID with a one
Mhm.
particular test. This is the exact reason you have so many symptoms. Like so you have more than 200 symptoms that can be attributed to
Wow.
long COVID. Yeah.
Oh,
So when you think of that, you can't really have like one test and say that, okay, you know what, I'm gonna take this and know what that we have long COVID. But yeah, but one thing is for sure is that symptoms of long COVID generally means they start 4 weeks after the initial infection, right? So if you've suffered from COVID, even mild or bad or whatever, 4 weeks after that, if your symptoms still persist and you have some trouble breathing and etc., best to consult your healthcare professional and seek help.
okay, that's yeah. I mean, that's interesting to know because of the fact that I mean, any health issue a person can have can be kind of exacerbated by COVID
Yes.
itself.
Yeah.
And now the fact that there is something called as long COVID and the after effects of the virus, these kind of issues can again pop up, and we will not even know whether it's actually the virus and its after effect, or it's basically our system which was before the virus
Right.
infected us, right? So
Right.
it's hard to gauge what exactly is happening with your body when at this point of time, which is hard for both, I guess, healthcare professionals and normal people who have actually suffered from COVID, because I
Exactly.
think who knows what exactly
Yeah.
is up with them. But yeah, I mean, this is something that I think people should know about before, at least the fact that a lot of people have suffered from the
Yeah.
virus. So yeah, I get. So before we continue, let's just take a small break and we'll be right back. Welcome back to this episode of All Things Policy. So we were discussing about something called as long COVID and the after effects of the COVID-19 virus itself. So Priyal, you mentioned that there have been studies done on regarding long COVID and the symptoms and how there were almost 200 symptoms which are, attributed to long COVID itself. One thing you said that the studies were done on adults, so,
Hmm.
has there been anything related to the kids or any other age group which you
Right.
have come across? And if you have, like, what have been the kind of results which are seen in like younger age group or like the
Right.
kids in general?
Yeah. So, like I said, right earlier, a lot of studies on long COVID has been done on adults and not on kids, rightfully so, because getting permissions, ethical, this thing and all is very difficult in kids in general. But I did come across like two major studies that were done on about long COVID in kids. Now, one of the earliest studies, one of the first studies of long COVID in kids showed that its effect could last for over 120 days in more than 50% of the children that were of the age group of, 6 to 16. And nearly 42% of these kids reported, symptoms like fatigue, joint pain, insomnia, headaches, palpitations, as well as like respiratory issues that were hindering their day to day functioning. In June 2022, Lancet actually published data on long COVID symptoms, on which they conducted a study in Denmark on kids between 0 to 14 years of age. That was the age group. And they did the study on over like 10,000 kids infected with COVID-19 virus and nearly 30,000 kids that were uninfected. And some of the kids reported so the COVID-19 infected children, they showed like long lasting symptoms such as mood swings, rashes, headaches, etc. And so kids between like 0 to 3 years of age who were like COVID-19 infected often, experienced like mood swings, stomach aches and rashes. Now, additional to that, kids between like 4 to 11 also complained about trouble memorizing, trouble remembering, trouble concentrating, sort of like a brain fog like thing. And the kids between 12 to 14, in addition to all of these, right, stomach aches, rashes, mood swings, trouble concentrating, remembering, all of these, along with that, they also complain like fatigue and stuff. Now, there was also another study of long COVID in children and adolescents, which was, if I'm not wrong, it was done in UK. They also showed that the prevalence of long COVID in kids was almost 25%. So 1 in 4 kids who was infected by COVID-19 had potentially showed a long COVID symptoms. And like previous studies, in this study also, kids were complaining about mood swings, fatigue, sleep disorders, like, not being able to sleep. And they also, a lot of kids who had suffered from this virus, this infection, COVID-19 virus infection, also showed higher risk of shortness of breath, loss of smell, loss of taste, fever, etc., when compared to kids who were not infected by COVID-19 virus. But these are just like very, even though the data set is quite big, right? Like 10,000, 30,000 kids and everything. But still the number of studies that are done in kids is very small in number, right? And because of which it is very difficult to sort of conclusively draw the results. It's very difficult to say, okay, you know what, these are all the symptoms that the kids are going to experience, etc. But and one more thing that I noticed was in the first wave of COVID or in the second wave of COVID, we sort of knew there was ample amount of data that kind of showed that kids were less susceptible to the COVID-19 infection when compared to adults, especially during second wave, right? During the Delta variant, we didn't have as many kids being hospitalized, etc. It was mostly the adults who were more susceptible to the virus. And when I was reading about as to why kids don't exactly end up being why the kids are less susceptible, I read about this thing that there was this article that said that one of the reasons why that kids reduce susceptibility is mainly because children have there's this receptors called ACE2 receptors. These receptors are important because they are the main entry point for the virus. So in kids, these receptors are far lesser in number when compared to adults, right? But since the Omicron variant popped up, the number of kids who were infected by the virus had increased. And it could be possible, one, because obviously Omicron was more contagious than the previous versions of COVID-19. And this potentially caused a lot of kids to be infected. And another reason is also could be that Omicron had the ability to sort of evade the immune response when compared to the earlier variants. So this could potentially be the reason. But because there are so little studies done in children, it's very in order to sort of make very conclusive judgments, we do need more studies on like long-term COVID-19 symptoms, long COVID symptoms in kids and stuff.
Okay, I mean, this is something that I guess everyone kind of expected in terms of the fact that, as you said, right, like a lot of kids were affected from the second wave
Right.
and even the Omicron variant. It's just hard to gauge now whether, how much of it would be a factor and for how long would it be a factor, right?
And also, I think one of the drawbacks that I noticed in these studies was also that you can't really define long COVID in a certain bracket, like because of so many symptoms
Okay.
and stuff, right? So the definition of long COVID in itself is quite evolving with time, as you discover. Like initially, they thought like these 10 symptoms were related to long COVID, and then more symptoms got added. Then more symptoms got added. So the definition in itself is quite evolving. And with that, and also there is certain, all of these kids, their parents report these symptoms to their doctors and healthcare professionals, right? So sometimes there could be some bias there as well, because if parents think that, oh, these are not really bad or whatever, they won't report it. So all of these need to be taken into consideration. So to conclusively draw any sort of conclusion for this, we'll need more studies.
Yeah, that's true. I mean, again, the data and how much the study is done, it kind of takes time, especially with the pandemic still ongoing. So I
Yeah,
guess
exactly.
I think we still have to wait for a bit. But my last question, right? So is there any way to mitigate these effects or long-term effects of COVID? Because I mean, the fact that if you've got the virus and you've recovered from it, now we know that it's not over yet. So there might be
Right,
still
right,
some kind of lingering effects due to this
right.
long COVID. Is there any way that we could kind of mitigate that? Or do people who have experienced the COVID-19 infection actually have to live with the possibility of, some kind of lingering effects of COVID for a while?
Right. So
Mhm.
interestingly, one of the papers that I read while I was reading about long COVID said that people who are vaccinated do recover from long COVID, but this sample size was too small for that study. So I can't really guarantee you that if you're vaccinated, you are safe from long COVID or you'll recover from long COVID. But CDC did put out guidelines for doctors as to how to treat long COVID and how to sort of mitigate the effects of it. In fact, even Ministry of Health and Family Welfare under the Government of India did put out a comprehensive set of guidelines for doctors to sort of manage long COVID symptoms. All right. But India does not have any studies of long COVID in children. Okay. So
Okay.
it is very difficult to know the numbers of, kids who are affected by long COVID as of now. And given this uncertainty, given this void of data that we are currently having, India can still sort of continue to prevent long COVID in kids by, mandating masks and social distancing in schools, because the pandemic is not over. We're still living in a pandemic, right? I know
Yep.
that even like while we go to work, etc., we do see people without mask. We don't see social distancing anymore, and etc. But I think we still need to reiterate that we still are living in a pandemic, even though there are some relaxations regarding certain rules and stuff. We still need to constantly have our masks on and as much as possible do maintain some social distancing. And there have been previous studies that have shown that adults who are vaccinated have shown lesser risk of developing long COVID. Okay, so this could potentially also be true for kids as well, right? We this could be true. I'm not saying it will be, but we do need conclusive studies about that. And we need comparative studies as well between vaccinated kids and non-vaccinated kids. What is the prevalence of long COVID in the two in those two groups? And then maybe we can come up to, certain sort of inferences saying that, okay, if you are vaccinated, the prevalence of long COVID might be lesser in kids if you're vaccinated versus if you're non-vaccinated. Then maybe we can come up with the better ways of, mitigating this. But given the fact that we do not have all of these right now, one thing what India can do and what we can do is obviously mandate the mask and social distancing. Another thing is, increasing the vaccination drive. Like we know for kids in India, vaccination drive started sometime in January 2022, right? This year. And there have been nearly, I think, 50 million children between 15 to 18 have been completely vaccinated. And nearly there have been almost 25 million children between 12 to 14 years old also who have been vaccinated, administered 2 doses of the COVID vaccine. And a lot of these vaccination drives were conducted in schools and stuff. And so basically what we can do is sort of increase these numbers as soon as possible. And also another thing is what we can do is have more studies about the safety and efficacy of these COVID-19 vaccines on kids, between 0 to 12 years of age. See if the vaccines that we have developed or that are currently present are safe and efficacious for kids, because currently the vaccines that are there that have been cleared by DGCI, etc., for emergency cases. We do not have vaccination drive for kids of this age group. And there are multiple reasons why vaccination in kids have also not been done. But I think if we have more studies on it, and once we determine it, and if that is proved, then maybe we can start vaccinating kids of that age group. And that could potentially help us, sort of prevent the prevalence of long COVID in kids, which I think is important because, in kids, right, because they are at their, they are developing kids, right? And you don't know what these effects the long-term effects they would have in their adult life. We have no idea about it. All we can do is we have to wait, and maybe these studies can only be conducted when, some 15, 17 years later. And knowing that the best way to go about it is basically prevent it from affecting many more kids. Because at least if we go by the numbers of statistics based on the studies that were done in UK or Denmark or something, is that nearly 25% of the kids who are infected with COVID have the chances of getting long COVID. So if we were to go by those numbers, and if we sort of correlate those numbers to India's population, that's a large number of kids, right? So the best way to go about it is sort of prevent it from happening, and then sort of, rely more on data. I think I would vouch for more studies and more data.
Yeah, well, I hope that happens as soon as possible. Thank you so much, Priyal. Also, I guess vaccination is one of the ways to prevent, any kind of,
Right.
So I guess vaccination should be a major factor for both the government and the individual itself. So get vaccinated, guys. So,
exactly. And that reminds me, government has said free vaccination for booster dose between ages of 18 to whatever. So please get vaccinated. For the next 70 days, the vaccination is free. So all the listeners who have not gotten a booster vaccine, please do get vaccinated. So yeah.
Yeah. Thank you so much, Priyal, for that advice. And thank you, listeners, for tuning in. Hopefully we'll see you in the next episode of All Things Policy. Bye-bye.
Bye-bye. Bye.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.